Hi, everyone. Welcome to our webinar this evening. Before we get started, I just wanted to do a territorial acknowledgement. Community Education Services acknowledges that the land on which we virtually gather today is the traditional territories of the people of the Treaty 7 region in southern Alberta. The city of Calgary is also home to Métis Nation of Alberta, Region 3. So welcome everyone to this evening's talk titled All of My Coping Strategies Went Out the Window, How Neurodivergent Individuals and Their Caregivers Are Coping During the Pandemic. Myself, Dr. Kaylin Turner and Kelsey Friesen are excited to be here tonight to present some findings from our Families Facing COVID national study, which we'll describe in a few minutes. Now, before we get started, we just thought it would be a good idea to get a sense of who we have here in the audience. And so, Wendy, if you could just put up our first poll question.
Yep, I've popped them in there.
Perfect.
People. Oh, got a healthcare provider.
Yeah, so just trying to get a sense of who's there. Is it who's attending this evening? Is it a healthcare provider, a caregiver? How would you identify?
Another healthcare provider, a researcher, a B and a B. Hold on, a B is another healthcare provider, ASD consultant, FSCD caseworker.
Wonderful.
And a D, a researcher again.
Wonderful.
And did you want that second question up now as well?
Yes, please.
Okay.
So our second question is, if you are a caregiver, if your child identifies as being neurodivergent, meaning that they identify as having autism, fetal alcohol spectrum disorder, ADHD, learning disability, those sorts of things. And so your options are yes, no, or I prefer not to say. And so Wendy, I can't see what people are saying, so it'd be helpful if you could tell me again.
Yep, there's a no, there's a social worker from the previous question, a yes, a yes, a yes, yes.
Okay, wonderful.
Yes, and 2 more yeses.
Okay, great. Well, thank you everyone for being here tonight. We're hoping that this information can be helpful for caregivers, caregivers of neurodivergent individuals or people who identify as neurotypical, as well as researchers or healthcare providers. All right, and just a brief language disclaimer. So to respect both person first and identity first perspectives, we will be using autistic person and person with autism interchangeably throughout this presentation. Now, to make sure that all of us are sort of on the same page, I wanted to just provide a brief overview of what we sort of consider to be neurodevelopmental disabilities, or NDDs for short. So NDDs are a group of disabilities in which the development of the brain is impacted, and it can typically manifest or present as neuropsychiatric difficulties or challenges in brain function, learning, language, or nonverbal communication. NDDs includes things like autism, ADHD, communication or language disorders, intellectual disability, and learning disabilities. Now, this model here that we present is a bit deceiving as there's considerable overlap between NDDs. So for example, what we know is about 40% of autistic individuals have also an intellectual disability, and also ADHD and autism co-occur quite frequently. Now, most recently, the term neurodivergent has been used to reflect those individuals who have a less typical, quote unquote, cognitive or brain profile. And the sort of framework or viewpoint of neurodiversity is that brain differences are normal rather than deficit. And so we will be using those terms throughout the presentation this evening as well. Now, for why we're all here, we sort of want to understand how COVID has impacted neurodivergent children. So COVID-19 has brought on unique challenges for everyone. I can say that confidently because my son is in daycare and has been in and out of spending time with us on an ongoing basis while trying to juggle a million things. But COVID-19 might be particularly stressful for neurodivergent individuals, such as autistic people and their family. So what we know is that the consequences of social distancing measures put in place to decrease the transmission of COVID-19 may be disproportionately affecting children with autism and their family. So prior to the pandemic, we knew that most children with autism experience these debilitating mental health issues compared to the general population. So for example, we know about 70% of autistic children will experience anxiety or some sort of stress-related disorder. Now, during times of isolation, these mental health symptoms might be exacerbated or even heightened, and that children with autism may be particularly vulnerable to the effects of prolonged isolation or quarantine and may have difficulty adapting to this new normal, especially due to some inherent difficulties in inflexibility or insistence on sameness and the disruptions to service that are needed to really support these unique change or needs. So when we think about sort of disruption to services and to supports, which has been a huge thing that I know a lot of caregivers have been experiencing, we know that autistic people before COVID experienced significant barriers in accessing services, such as just wait lists, finding a care provider who feels competent or confident in treating or managing or navigating services with an autistic person who has mental health issues. But now sort of these barriers have been, again, heightened or increased because of COVID-19. And so we're seeing a substantial disruption in services for families of autistic people. And this is mostly due to isolation. They're cut off from most of their support systems. And earlier in the pandemic, a lot of us were still trying to figure out this online system. And so how do we provide service online? And there's been some trials and tribulations around that. But I think for the most part, services have been disrupted or canceled and are still trying to get up and running to being back to the way we were pre-pandemic. And so from a study that we did, we found that about 88% of families experienced a change or disruption in at least one service. And the most frequently changed or disrupted service, unsurprisingly, was being behavioral therapy, one that's really hard to do online. I'm sure people have figured out ways to do this effectively, but in the beginning, that was the one that was most disrupted over time. The majority of caregivers indicate that the support in response to COVID has not been sufficient to meet their child's needs. And so there was one quote that we had where my son experienced a substantial escalation in problem behaviors. So again, those mental health issues really becoming worse, including physical aggression during this time. But we had considerably less access to support services, and that negatively impacted our family. Now, a study was done in collaboration between Autism Speaks Canada and the McMaster Autism Research Team, and the study was called the PAN-CANS, and it was done over the summer, where they tried to really get a sense of what this disruption of services for autistic people looked like. So in particular, they asked families, so caregivers as well as self-advocates who had autism, what supports they weren't accessing but would have found really useful at the time of COVID-19 during the first wave. And these were the highest rated services as reported by caregivers. So those included things like recreational programs and products, flexibility using government funding, financial support, mental health supports, an autism specific hotline, peer and family support. And similarly, there was a lot of overlap when we asked the same question from self-advocates. So they identified the highest needed supports during COVID were things like recreational programming, an autism specific hotline, financial support, access to health professionals, and mental health supports. Now, why is it that people with disabilities are disproportionately impacted by COVID-19? And as I sort of alluded to already, is that people with disabilities or NDDs face obstacles in accessing prevention and intervention supports. And that was something that they experienced prior to COVID, but is again being reinforced during this time. And part of that is because there's a lot of information that's inaccessible to people with disabilities, whether that be because the reading level is not sufficient or the verbal communication is not sufficient. I mean, I even find it hard to figure out things like vaccines, information about healthcare, et cetera. And so I think that information just hasn't been very well executed or accessible to people with disabilities. And they already are facing these barriers in accessing essential health services, which is where a lot of this information comes from your GP or your primary healthcare provider. We also know that quarantine and health facilities and the transports that were established as part of the COVID-19 response may fail to really be accessible for people with disabilities. And lastly, some recent headlines outlining how individuals are really with disabilities are disproportionately impacted by COVID, including sort of priority setting for COVID-19 vaccines, despite there being a heightened risk for substantial harm or impact of the virus should one get it. So we wanted to understand what the impact of COVID-19 was on neurodivergent children and their families. And so we created the Families Facing COVID National Study. And as I mentioned, we'll be describing findings from this study in a few minutes here, but just to give you a little background about the study. So again, in collaboration with two of my colleagues, Dr. Connor Kearns at the University of British Columbia and Dr. Jonathan Weiss at York University, we really wanted to understand how the pandemic impacted caregivers and individuals with neurodevelopmental disorders, including autism, FASD, and cerebral palsy, and intellectual disabilities. We wanted to understand how caregivers, as well as autistic individuals' well-being, coping, and stress were all impacted by COVID-19. And we weren't just interested in what was going wrong or what wasn't going well, but we wanted to understand how potentially some families were thriving, because we were hearing from some families that they're feeling more connected to their family, or they're able to spend more time with their kiddo. And so we wanted to capture what was helping or what was going well, in addition to the things that families were struggling in. This was a national study that we collected data from June to July of 2020. And tonight we are only going to be presenting on about 625 caregivers of individuals with autism. We've had over 2,000 people who participated from various groups, all of which were recruited online using social media or through local agencies and community agencies who support people with neurodivergent needs. Now, to give you a sense of just who participated in the study, as I mentioned, we had 625 plus caregivers of children with autism who responded between June and July. Majority of the people who completed the study were caregivers and identified as being parents in particular. 94.6% reported having one child with autism in the household, and the majority of those children were male between the ages of 1 and 10 years of age, with a mean age around 8.6 years. 43.2% of the respondents reported that the severity of their child's autism symptoms were mild. 45% indicated more moderate symptoms, and 11% indicated their child's symptoms or traits were more severe. Just under half of our caregivers reported their child had one or more additional mental health diagnoses, and a minority of respondents reported having 2 or more children with autism in the household. And as you can see, most respondents were from Ontario, British Columbia, and Alberta, and as well, most caregivers identified as being white or Caucasian. Next, I'll just hand it over to Dr. Kaylin Turner, who will present on mental health and well-being in our Families Facing COVID study. Kaylin?
Hi there. Can you hear me okay, Carly?
Yep, we can.
Perfect. Great. Okay, thank you. Yeah, so I am happy to share some results from one of our projects from the Families Facing COVID study that Carly just introduced. And so this project that I'm going to be talking specifically about is regarding mental health and well-being in children with autism during the pandemic. Next, Carly. Thank you. So Carly's given lots of great background information and rationale about why we were interested in doing this study generally, but just a couple of important points about this particular study. So Carly shared that we know prior to the pandemic, autistic children and youth showed a higher degree of co-occurring mental health conditions than non-autistic individuals. And we know that those have or can have a negative impact on child and family well-being, quality of life. Sorry, I was hearing some background noise. So Carly also mentioned, we know that these children are more likely to receive special education or professional therapy support services, which was happening prior to the pandemic. And caregivers of these children have been shown to experience higher levels of stress compared to non-autistic children and caregivers of children with other disabilities. And that might be because caregivers face unique stressors related to their child's autism traits or social emotional experience. They might experience concern about their child's development or future and possible stigma against their child and family. We also know that early in the pandemic, a couple of rapid response or quickly put together and executed studies showed that many households were facing economic crisis and scarcity of essential resources and goods. A study specifically examining the experience of autistic children and youth in the United States showed that these children were indeed facing significant disruptions to their professional therapy services. And this study also suggested that children may be experiencing more pronounced or worsening autism traits, increased behavioral challenges, and reduced overall child and parent mental health. So one of the questions we had related to our families facing COVID study was, how are autistic children and their families doing more generally? Next, Carly. So with this in mind, thank you. With this in mind, we wanted to understand how autistic children were doing, and we took a developmental ecological perspective. So this perspective suggests that child well-being is really shaped by multiple levels of influence. So not just one factor or level of influence is important, but that we need to understand multiple levels. Including characteristics of the child, the caregiver, and the environment. So the environment might be things like the household or the community or the broader society. We were specifically interested in what these characteristics or the role that these characteristics might have in child mental health during the pandemic, as well as autism characteristics and social emotional symptoms. So you can see that we were especially interested regarding the child in the potential unique role of autism severity or the level of autism severity, of whether the child had a prior co-occurring mental health condition. We were interested at the caregiver level in stress, caregiver stress, and what role that might play. And at the environmental level, we were interested in the level of household disruption, as well as professional service disruption due to COVID-19 and the role that that might play. Next, please, Carly. So a little bit, so specifically just a couple of aims that we were hoping to understand in this particular study. We hoped to describe changes in autism traits and social emotional symptoms, as well as the degree of perceived caregiver stress and household and service disruption. We also wanted to examine whether child mental health differed prior to and during the pandemic. And then we wanted to see, as I mentioned, what might be associated with changes in autism traits, social emotional symptoms, and child mental health during the pandemic. Next. So a little bit about what we found. About half of the caregivers in this study reported that their child or youth experienced more autism characteristics than usual. So, for example, this was things like restricted repetitive behaviors, social communication challenges, sensory issues, and interest in special topics or objects. So about half of the caregivers in this survey reported that their child was experiencing more of those things than they typically were. Similarly, about half of the caregivers reported that their child or youth was experiencing more behavior problems, anxiety, or lower mood than they usually were. Parents also reported feeling concerned about a number of different things. So they were concerned about things like their child's readiness for the next school year, the progress that they would be making in therapy, their screen use. And you can see that parents were especially concerned about their child reconnecting socially with peers and their child's lack of physical activity early on in the pandemic. Next. So important to remember that while about half of the caregivers in this study did observe more autism traits and social emotional symptoms than usual, not all children and youth experienced a worsening of symptoms. So this is just a reminder to show us that about half of the caregivers reported that their child was not necessarily experiencing a worsening of symptoms. Next. All right, so a little bit about the caregiver stress and household and service disruption. So we found that most caregivers reported a moderate level of stress in this study. About half of the caregivers reported their overall life to be disrupted. And some families experienced financial hardship and shortage of essential goods. Most families had disruption to at least one of their professional services, and many families reported service to multiple different services. And you can see that families experienced either services being canceled, temporarily being unavailable, or transitioning to remote service delivery. Next. All right, so when we looked at what happened with child mental health prior to and during the pandemic, we did see that child's pre-pandemic mental health differed significantly from the pandemic mental health rating, with a worsening overall mental health score. So here we're comparing the group means, or the means of the group, according to the caregiver's retrospective report of the child's mental health 2 months prior to COVID, and then currently at the time that they completed the survey, which was very early in the pandemic. So we can see that there's a difference, a decrease in overall mental health. And although the difference is somewhat small, it is statistically significant. So it does tell us that there is seeming to be a reduction in overall parent-reported mental health for the child. Next. All right, so then next we used a statistical technique that's called hierarchical regression to understand factors that might be associated with a few key areas. So first, we were interested in what is associated with greater autism traits or characteristics during the pandemic. And so remember that we were using the developmental ecological perspective. So we entered our variables into a model, starting with demographic factors. So this was things like the child's age, the child's gender, and household financial status prior to the pandemic. And then we added child, caregiver, and environmental characteristics. So in this case, you can see that we found older child age, having a pre-existing mental health condition, higher caregiver stress, greater household disruption, and greater service disruption were all significantly associated with having greater autism traits during the pandemic. And if we look at the pie chart, you can see that if we take all of these variables together, they account for about 23% of the variance in greater autism traits during the pandemic. So that means that we have identified some important factors for predicting greater autism traits during the pandemic, but it also tells us that there are other factors explaining this that we haven't captured here and that we need to keep thinking about. Next. So we took a similar approach when we looked at what is associated with greater social emotional symptoms during the pandemic for autistic children. And this time we found, again, that older child age, having a pre-existing mental health condition, having a more severe level of autism, higher caregiver stress, greater household disruption, and greater service disruption are all significantly associated with greater social emotional symptoms during the pandemic. So taken together in the pie chart, you can see that these variables accounted for approximately 20% of the variance in greater social emotional symptoms during the pandemic. So again, we've identified some important factors for predicting this, but not all. So there's more to understand here as well. Next. And then lastly, we were interested in what was associated with better child mental health during the pandemic. And we took the same approach. You can see here that we found being female, the child being female, having less household financial difficulty prior to COVID-19, not having a pre-existing mental health condition and less severe autism, as well as less caregiver stress and less disruption to professional services, was associated with better child mental health during the pandemic. So in this case, we accounted for 17% of the variance. So we've started to identify some important factors in understanding what is associated with better child mental health during this time. But still there is more to understand. Thanks. So just to summarize some of the key findings that I've covered, we did find caregivers reported some autistic children to experience worsening autism traits, increased social emotional symptoms, and a reduction in overall mental health during the pandemic. Most caregivers reported a moderate degree of perceived stress, and approximately half reported household disruption. Most families experienced cancellation or change to their professional therapies and services. Next. And we did identify a number of factors that seem to play a role in worsening autism traits, social emotional symptoms, and child mental health during the pandemic. So things like child age, having financial difficulty prior to COVID-19, having pre-existing mental health concern, the level of autism severity, having a high degree of caregiver stress, and having household and service disruption due to COVID-19 all seem to be really important in explaining what's going on for children and their families right now. And there are certainly additional factors that we haven't identified in this study that we would like to explore in future research. Next. So this is one of few studies to describe the experience of autistic children, particularly in Canada during the pandemic. And our findings do provide a snapshot of early pandemic functioning in parent-reported child mental health and suggest some factors that we could start to sort of work with and others that should be explored. Caregivers and families may benefit from targeted supports to manage stress and to bolster adaptive coping, which we are going to talk further about at the end of our presentation, give you a few ideas. And service providers might want to consider characteristics such as household financial status, pre-existing mental health concerns, level of autism severity, caregiver stress, and household and service disruption when they're thinking about their treatment and support planning. So next, I'll just make sure. I think that's it for me. I'll pass it to Kelsey.
Thank you so much, Kaylin and Carly. You can both hear me okay? Great. Okay, so I will switch gears here now to talk a little bit about the experiences of caregivers of children with autism during COVID-19, specifically looking at mental health and resilient coping. Next. So the team wrote a piece about this just a few months ago. There was a really fantastic parent advocate who agreed to speak about their family's experience. And one of the quotes that really stuck out was the one on the slide here. So these last few months have been immensely stressful. All my positive coping strategies went out the window. So we'll talk a little bit more as we go on about how our caregivers are doing, but a number of families are having considerable difficulty during these times. Next. Thank you. So we do know that before COVID-19, it was well established that caregivers of autistic individuals experienced higher rates of mental health problems compared to both the general population and caregivers of children with other disabilities. And these caregivers were reporting higher levels of things like perceived stress, depression, and then anxiety symptoms as well. And when we consider all this, the mental health issues present in caregivers of autistic people may be exacerbated during COVID-19 due to the impact of various difficulties and disruptions associated with the pandemic, which has the potential to present considerable additional challenges over and above those typically experienced by these caregivers. Next. So the mental health of caregivers of autistic individuals likely reflects the accumulation of a number of different stressors. So we have family and caregiver mental health outcomes, which are further impacted by child and family characteristics. And so we have some on the slide here. I'll name a few child characteristics, including things like high activity level, high support needs, non-compliant behavior, emotional and behavioral difficulties. These and others have been correlated with parent reports of distress, mental health difficulties, and reduced quality of life. And parents' characteristics can also emerge as contributing factors. And just to name a few from the slide, we have things like low levels of perceived social support, lower household income, difficulty with finances, and others like this. Next. So for this study, we used the double ABCX model of family stress or family adaptation by McCubbin and Patterson. And this was used to describe the experiences of parents raising an autistic child in this study and a number of studies previous. Next. Okay, so in our orange circle is the area we'll be focusing on for our study. So the double ABCX model proposes that the process of adaptation to a stressful event, a stressful situation by caregivers, such as COVID-19, is the product of the interaction between 4 different factors. So we have family demands. So this can be the accumulation of stressors that I mentioned. For example, child characteristics, family characteristics, financial strain. Just to name a few examples. The second one is family adaptive resources. So an example of this would be social support and other resources the family may have. Family perception or their definition of the stressful situation. And so this includes perception of the stressor, perception of the accumulated strains, and perception of the resources. And then the last one is family adaptive coping. And so the mental health of caregivers of autistic individuals during COVID-19 most likely reflects the accumulation of COVID-19 related stressors, difficulties and disruptions, child characteristics, resources appraisals, and then resilience as well. Next. So what is the impact of COVID? As was previously mentioned, the impact of disruptions linked to COVID has the potential to present considerable additional challenges to parents and other caregivers. So Carly mentioned this at the beginning, but traditional in-person social, educational, therapeutic programs and services have been paused or modified, so potentially transitioning to an online platform if it allows. And disruptions to supports, routines, this can all lead to an increase in the frequency and severity of difficulties experienced by autistic children and their families. And then as a result of physical distancing restrictions, caregivers may have adopted multiple roles, so taking on the role of a parent, but also an educator, and may have transitioned either to working from home, having to balance caregiving and work, or potentially working outside the home in environments that might be increasing their level of personal risk. And these factors all have the potential to contribute to higher levels of stress in an already stressed group of caregivers. Next. So what is the research telling us about the impact of COVID-19? There was a study by Manning and colleagues in 2020 that examined COVID-19 related experiences of autistic children and their families. And they found that caregivers of younger individuals and those with greater severity of autism symptoms had higher levels of stress. And stress was particularly associated with disruptions of services, isolation, illness, and finance. And then in a second study, White and colleagues found that the majority of respondents were reporting moderate to extreme levels of stress, and almost half were endorsing moderate or marked levels of family distress. Next. So what is the role of, or the potential role of resilience, which is what this study really wanted to get to know. So resilient coping or resilience is the management of a stressful situation that leads to an adaptive or a positive outcome and can help caregivers managing the stressors associated with caring for an autistic individual. And so for the present study, it was operationalized as the actions an individual might take to manage stressors in an adaptive way that leads to a positive outcome. And so we know that compared to the general population, caregivers of autistic individuals report lower resilient coping, and resilient coping is suggested to be a buffer or potentially act as a buffer against anxiety and depression in both caregivers of autistic and non-autistic people. And we have research to show that caregivers who are higher in resilient coping have increased marital quality, life satisfaction, quality of life, as well as less depression, anxiety, insomnia, somatic symptoms, and parenting stress. And so in the context of COVID-19, we do have emerging literature that's highlighting that caregivers of autistic individuals are having difficulty managing demands, but we don't yet understand the role of resilience here, which is one of the reasons why we're looking into it next. So the objectives of this study were to characterize caregiver stress, anxiety, and resilience during COVID-19, and then additionally to identify the impact of certain demographic factors, so those child and family characteristics I mentioned, other individual factors such as resilience or resilient coping, and COVID-19 disruptions that are associated with caregiver stress and anxiety. And we also wanted to look at the possible moderation of resilience on the association between COVID-19 difficulties and caregiver mental health. And so we expected that caregivers of autistic children would have higher levels of perceived stress and anxiety and be lower in resilience. And we also predicted that caregiver stress and anxiety would be associated with some of those demographic variables, such as number of children in the home, age of the child, severity of the autism traits, things like that, as well as the difficulties and disruptions associated with COVID. And then finally, it was anticipated that the association between the difficulties and the disruptions and stress and anxiety would be reduced in caregivers who were higher in resilience. Next. Okay, so Kaylin mentioned a bit of this, but here's just some more detail about those difficulties and disruptions that the respondents are reporting. So the majority reported some degree of difficulty and disruption as a result of COVID-19, ranging from things like financial hardship down to difficulties finding childcare. And the ones that are circled are where more greater than 50% endorsed somewhat, moderately, quite a bit, or extremely disrupted in these areas. Next. Overall, caregivers in the current study were moderately stressed, as well as they reported high levels of anxiety. And similarly to what we predicted regarding resilience, almost half, so 48.9%, fell in the low resilient coping group. The second largest was medium, which was just over 30%. And then high resilient copers were the smallest group of respondents in the present study. Next. In our sample, looking at those demographic factors, caregiver stress and anxiety were weakly associated with demographic factors and difficulties and disruptions. So of the correlations, the strongest of the weak correlations were between stress and financial management and difficulties and disruptions. So with poorer financial management and greater difficulties and disruptions being associated with higher levels of stress in our caregivers. Next. And then with anxiety, we also saw weak correlations, but statistically significant. The strongest, again, was financial management. So similarly, more challenges with managing financially was associated with greater levels of caregiver anxiety. And although these associations do suggest the presence of meaningful relations between child and family factors and caregiver mental health, the majority were weak, although statistically significant. And then interestingly, caregiver anxiety was not associated with difficulties and disruptions due to COVID-19, although this could be due to a variety of different reasons, one of which being limited measurement. And so similarly to Kaylin, we did use a hierarchical regression for stress and anxiety. So looking at stress, we explored the associations between stressors and resilient coping on mental health. So looking at our model, resilient coping was associated with stress in the expected direction. So those with lower resilient coping were reporting higher levels, or it was associated with higher levels of stress. So caregiver mental health during COVID-19 seems to be associated with the accumulation of stressors and reduced resilient coping. And so our model here, difficulties and disruptions and demographics, was significant and stayed significant when we added in resilient coping. And altogether, it explained 18% of the variance in stress. So just like Keelan mentioned, there is quite a lot that's still unaccounted for. And only a small amount of the variance was accounted for by the variables in the model. Next. And looking at anxiety, we see something similar. Although certain demographic factors were associated with anxiety, the addition of difficulties and disruptions did not explain any more variance. Although when we added in resilient coping, this was significant. Although this model again only accounted for a small amount of variance. So this time about 13.5% of the variance in anxiety. And then unexpectedly, resilient coping did not emerge as a moderator in the association between COVID-19 difficulties and disruptions and caregiver mental health. And I'll talk in a few moments about why that may be. Okay, so do a quick summary of the facts or the points I just mentioned. So the majority of respondents reported some degree of difficulties and disruptions as a result of COVID-19, consistent with recent research. The majority of the participants in the sample indicated they were experiencing moderate levels of stress and high anxiety. And the majority of caregivers were low in resilient coping, and high resilient copers accounted for the smallest group of participants. Next. And in our sample, caregiver stress and anxiety were associated with both demographic factors and difficulties and disruptions associated with COVID-19. And although these associations suggest the presence of meaningful relations between child and family demographic factors and caregiver mental health, the majority were weakly correlated. And so this suggests the presence of additional influential factors that fell outside of the scope of the present study. And just to name an example, one of the primary indicators of parental adaptation is adaptive resources, as I mentioned back when we were talking about the model. And this can include social support and access to resources. And as these were not included in the analysis, it's possible that influences such as social supports might be contributing to caregiver functioning prior to and during COVID-19. The results of the study also suggest that caregiver mental health is impacted by the accumulation of stressors and reduced resilience. And although the models were significant, only a small amount of the variance in stress and anxiety were accounted for by the independent variables. And so while it seems that resilience does certainly play a role, it doesn't appear to be a dominant factor impacting the mental health of caregivers in our sample. Next. Okay. And then, as I mentioned, resilient coping did not emerge as a moderator in the association between difficulties and disruptions and mental health. And so within resilience literature, there's 3 different models and the way that factors interact with risk to impact outcomes. So the compensatory model is the idea that resilient coping has a direct effect on outcomes, and the protective factor model the idea that it moderates the effects of risk on outcomes. And so the results in our study support the idea of resilience as being a compensatory factor instead of a protective factor. And so more specifically, caregivers who are using active, flexible steps to manage stress in an adaptive way seem to have a decreased risk or may have a decreased risk of mental health problems. And then unlike risk factors, resilient coping is operating in the opposite direction, promoting mental health independent of other risk and protective factors. But future research is necessary to get a better understanding of the role of resilience. Next. And then finally, we have a partial picture that's coming up in which a cumulative impact of stressors and other factors are impacting well-being. These factors are just a limited snapshot of the complete picture of mental health in caregivers during COVID-19. And the results do, though, suggest and represent a novel attempt to identify a key factor impacting caregiver outcomes, and that was resilient coping. Okay, so I'll go next here and I'll roll us right into our next section here, which will be supporting your family during times of stress. So now that we have a little bit more information about what that looks like, what can we do next? Okay, so we have a poll question. And so I believe it'll be just in the chat that you can respond here. But what has worked? So open-ended. What has worked for you if you are a caregiver, or if you know caregivers? What do you know that has been working well? And you can continue to answer in the chat as we move along. We'll take a look at those responses as they come in. Next.
Somebody has just responded that their friendship circle has helped them.
Love that. Sorry, I thought I could maybe see the chat, but I can't. Thank you, Penny.
Sorry.
No. Okay, so how do we support neurodivergent kids? So this is a bit of a summary and we'll go into a bit more detail as we move along, but as a family, you can create daily or weekly schedules that include time for learning and relaxation, by staying informed, but limiting time on social media to avoid being overwhelmed. So media is overwhelming for adults, let alone children. So limiting your access to too much news and limiting your children's exposure to the news. So not having it running in the background. Taking up or continuing a hobby, things like reading, playing games, potentially even meditation apps. Keeping contact with social support, so that friendship circle. I see trying to maintain routine came up in the chat, which yes, absolutely, and we'll get to that in a few moments. And then practicing self-care, so taking a walk outside, doing some exercise, doing something to fill up your bucket. And I see reducing clutter in the chat as well. Yes, certainly. That's something I need to do more of, actually. Next. And then some advice from other caregivers of things that have worked. So scheduling physical activity and skill building activities, spending time as a family, more time together, loosening screen time or bedtime restrictions, and then routines. So even building in pizza night Fridays or Sundays or whatever you'd like to do. And then the last one is taking time to talk about the family schedule, to find time to connect, meaningful time together. And then of course, sleep, eating healthy, getting outside, and then working with speech therapists, psychologists, pediatricians, and teachers to navigate best approaches and practices to regulation. So these are some really, really great strategies so that some other caregivers have found that worked. Next. And so some more options is going back to the basics, working on your relationships. So having that quality time, that one-on-one or special minutes, if you want to call them with your child or children. And then remembering not to focus on things that are outside of your control. So whether or not other people are following the rules, what other people are doing. Is there going to be hand sanitizer at the store? How long will this last? Instead, focusing on all the things that you can do. And there's lots of things we can do to keep ourselves and our kids connected to other people and activities that give us purpose, meaning, belonging, and hope, which is important to find. And then knowing the difference between real worries and hypothetical worries. So real worries are actual problems that need to be solved. They have a solution and they need it. And then hypothetical worries, this is worries about the current health crisis thinking, and it might include like worst case scenario or catastrophizing. And just knowing it's natural to worry, but if you feel like it's becoming excessive and taking over your life, that it might be worth trying to find some ways to limit the time you spend worrying and taking steps to manage your well-being. And then potentially reminding yourself that your mind is not focusing on a problem that you can solve, and trying to find ways to let go and find something else. I just saw another thing in the chat here. Healthy habits, yes, certainly. And then bringing in some self-compassion and gratitude through all this. So worry comes out of a place from love. And so reflecting on the things you're grateful for and modeling that it's okay to make mistakes and that you can always try again. And then we will reflect on our own feelings and talk about modeling, regulating the emotions on the next slide. Next. Okay. I guess the next two slides. Yes, take care of yourself. So caregivers need to make sure they're taking care of themselves in addition to following safety precautions. Self-care is important. Parents and caregivers take better care of their children when they're taking care of themselves. So eating well, getting rest, healthy habits, taking breaks, doing something fun or relaxing, and being kind to yourself is so, so important. Next. And then the key to helping your child regulate their emotions is to regulate your own emotions. And so to understand your child better, it can be helpful to understand yourself as well as your own relationship with your emotions, what your triggers are. That can be a good starting place. And then calming down before you react, taking steps to calm. Children might be responding to stress and might be acting out. And so this might be a sign that they need something from you. And so before you respond, take a few deep breaths or count to 10 or count backwards from 10. Staying calm helps us manage these situations better. And then if you can safely leave your child for a moment, you can take a step back from the situation to calm down, always telling them when you'll be back and coming back when you say you will. And then responding in a calm way and redirecting your attention to expected or positive behaviors when you do see them, helping your child recognize their own emotions. And so this might include identifying situations that might result in a big emotion, so the triggers for your child, and then knowing how to prepare your child for these things. And then help your child recognize how their body feels when they're having a big feeling. Is it hot? Is it shaky? And once they can start to identify this, then they might find it easier to then know what they need to do to start to come down from those big emotions. And then you might want to teach your child relaxation techniques. And so once you recognize big feelings, acknowledge them, your child might still have a difficult time calming down. And so you might want to make sure they have a quiet space in the home where they feel like they can be themselves and without losing control, somewhere safe. You might want to do some mindfulness activities with them. And the nice thing about that is trying lots of different things until you find what works. Next. And then routines, I think, came up in the chat at some point. And so children's routines and our routines have been hijacked, and everything they know is different, and this is stressful. And so we can help by creating routines, providing predictability, and explaining to our children what they have to do or what the expectations are. And so continuing to have regular wake up times, meal times, other daily routines, predictability and routines helps kids feel safe. And creating flexible but consistent routines. You can involve your children, get their input, set up a schedule that includes both structured activities as well as free time. And all of this can help children feel more secure. And then the importance of sleep. So sleep is important. It's important for children and they might have sleep problems during times of increased stress. So they might have trouble falling asleep, staying asleep, especially young children, particularly if they might be anxious about separating from mom or dad. And so maintaining a consistent bedtime and regular nightly routine can help with some of these problems. Nighttime bed routines, lights are dimmed so your child can start to unwind, making sure screens are turned off at least an hour before bedtime because of the blue light can interfere with the sleep-wake cycle. And then maybe offering extra comforts if your child needs some reassurance. And there's some more suggestions on the slide here, depending on your child's unique needs when it comes to sleep. And then explaining sleep if there's a difficulty understanding the need for it can be important, such as through social stories. Next. And then since so much has been changed or taken away from everyday life, it can be really nice to have something to look forward to keep kids motivated and us motivated. So setting up small rewards can be really good to help tackle unpleasant tasks. The whole family can be a part of it. And if we're all setting goals and planning breaks together, the kids can also see that it's a bit more of a team environment, which can really help with motivation. And then reward your children, remind them that they're doing well, and do what we need to do to help connect them with their peers, potentially through virtual platforms. Next. And then a few final notes here. Talk to your child about COVID-19. So speak about current events, provide accurate and easy to understand information so they have an understanding of what they need to do. Try to answer questions they have honestly, but it's okay to not know everything. With older kids, you can do a little knowledge journey together when it's appropriate. And so if your child does have questions, know that honesty is always the best policy. We don't want to frighten them, but there's nothing wrong with talking about the need for safety precautions such as social distancing and washing hands. So having age appropriate conversations. And social stories are a really great way to do this. These are germs that make people sick. Your job is to wash your hands, cover your cough, stay distanced, potentially doing a hand washing guide as well. And then make an emergency plan if you or your child needs to isolate. And then finally, there are available resources such as those on the slide. Okay, and I will pass it over to Carly.
Great, thanks, Kelsey. Can everyone hear me okay? I'm going to assume so, yes.
Yep.
All right,
Yes.
so thank you. All right, so in our last few minutes here before we take questions, we just wanted to provide some sort of suggestions for what we could do for kids. So kind of Kelsey focused on caregivers, and I'll provide some sorts of suggestions for what we can do for our kids, recognizing that every kid is different. And so, finding what works best for you and your family, allowing yourself or giving yourself permission to not be on and being perfect in terms of providing the greatest sorts of activities, et cetera, for your kid, because that can be exhausting as well. So here we're going to provide some activities for kids that vary in terms of ability level and safety level. So first, sensory activities are hugely important for kids with autism and other neurodivergent needs. So going for walks, playing at local parks in safe, socially distant ways, trampolines, creating dens and forts, whether that be inside or outside, obstacle courses, kids yoga. My little one is obsessed with Cosmic Kids Yoga on YouTube. I highly recommend it, especially the troll one in particular. And then heavy work activities, so things that can kind of get them out working, starting to be spring outside, gardening is a great activity, etc. Now, for kids who need some more sensory input in terms of oral motor activities, using a straw, eating different foods if that's comfortable for them, blowing bubbles, doing bubble art, etc., can be really helpful, blowing bubbles through a bottle, etc. And then we provided some activities both indoor and outdoor that are listed here. Now, in terms of other aspects to sort of what we can do for our kids is limiting technology. Now, I say this with a huge caveat. So when screens can be used, they can be really helpful. And sometimes we just need a break as parents to sort of put a screen on. Our kids need to sort of relax, and that might be really engaging or helpful in the moment. And so again, I say this with a caveat that do what's best for you and your family, but limit sort of that non-academic material to certain times. So it's predictable. Kids know when to expect it, how long it's going to be, etc. And this might be really helpful to include in your schedule. So it's something that kids can kind of work towards versus it being something that just kind of happens. Again, that predictability and working towards that screen time can be really helpful. And again, I really want to emphasize, especially because for me with a kiddo at home, sometimes we just need to use screens. And so the best time and the best way to do that too is engaging with your child while they're on a screen can be really helpful and have that shared time again together. The second thing is really when you're sort of transitioning between activities, and I know this is something that lots of people sort of practice, but really being able to speak to your child about now and next, or first this, then that, can be helpful, especially when things feel kind of uncertain and there's more chaos right now in life. And so that predictability and what to expect next can be really helpful, especially for our kiddos who have that sort of insistence on sameness and difficulties. Again, highlighting what others have said about routines and the importance of that. You can even create cards or different visual schedules or visual prompts that can really help to promote this sort of idea of first this, then this, or now and then next, and can help prepare kids to transition to the next activity. And then also giving warnings and reminders are also extremely helpful. All right. Now, one of the things, again, that we sort of wanted to highlight is taking advantage of the opportunity if the moment is right. So trying to be present in the moment if possible, to really sort of say and be grateful for the time that you have. Now, that's not going to be all the time. I recognize that. And so this is a challenging time, but if there are those small moments, being able to just say, gosh, this is really great right now. We're having a good time, or I really enjoy doing that with you, and vocalizing that for your child can be really helpful. Promoting sort of social communication and personal independence. So maybe that's having a new task every morning for your kiddo that they have to do, like a new chore or a new something to sort of either feed the pets or do something like that that can kind of teach them that independence, or whether it's engaging with somebody over FaceTime or with a peer, etc. Socially distanced can be really helpful. Playing or acting out their anxieties and fears. So as I mentioned earlier, our kiddos are at heightened risk for anxiety and fears. And so playing or acting those out can be really beneficial for promoting sort of that coping or that normalizing of those fears. And so whether that be sort of pretend play for younger kids, whether that's with stuffies or characters, or whether that's through visual story timing or crafting, it can be really helpful to sort of play or act out those anxieties. Giving them that sense of preparedness that they can manage anything, they're sort of that brave, they can face their fears, etc. And helps to really ease any anxiety around new situations that they might be experiencing, and teaching them how to cope, teaching them skills they can carry into adulthood. Now, in our last few minutes here, I just thought I would provide some brief resources that are here specific to the Calgary area. Obviously, if your kiddo is experiencing mental health issues, Access Mental Health is a great place to reach out. Distress Center can be helpful for anyone of any age if you're struggling with mental health issues. The Addiction and Mental Health website is there for you to also look through if you're needing some extra supports, as well as the Youth Addiction and Mental Health line and the Canadian Mental Health Association as well. Before we take questions, I just really wanted to thank all members of the Enhance Lab. So myself as the director of the Enhance Lab, and as well as Dr. Kaylin Turner, who presented on child mental health, and Kelsey Friesen. I feel so lucky to work with the students I do and learn from them. If you would like to learn more about our lab, here is all our contact information. Please feel free to reach out. I also wanted to say thank you to our funders who fund the work that we do, from this study to various studies that happen in my lab. And as well, and most importantly, thank all of the families who support the work we do, as well as my community stakeholders and clinicians, healthcare providers who I work with, and teach me how to make this work impactful. So thank you very much. And I think we can take some questions now, Wendy.
Come in. I'm not sure, Kelsey, do you see them? Do you see the questions?
I'm going to stop my share. Is that okay? So I can see questions?
Yep, you can stop. Yep. So
Hi,